Hi everyone, this is Arthur Lau from Rheumnow.com reporting on day 2 from the ACR. I want to update you guys on some of the osteoporosis stuff presented yesterday. So the FRAME trial was presented at a session yesterday about romosozumab, a monoclonal antibody which binds to sclerostin. It acts as an anabolic bone agent, so you're getting new bone formation and you're having less bone resorption as well, so it actually has that dual mechanism. So it was an RCT over 7,000 patients, looking at patients of osteoporosis with a T-score minus 2.5 to minus 3.5 at the hip. So patients were randomized for the first year to get either romosozumab, sub-Q injections, or placebo for the first year, and everyone crossed over to get denosumab injections every 6 months on year 2. What they showed is that in their two co-primary endpoints for vertebral fractures at 12 months, they had a 73% relative risk reduction, which was very significant compared to what we've seen so far. At 24 months, there was a 75% relative risk reduction, despite everyone crossing over to denosumab, which is, as you guys know, a very effective agent already in reducing vertebral fractures. So this does seem like it's actually a pretty good drug. Their secondary outcome, they looked at non-vertebral fractures at 12 months, and they found a trend towards significance, but there was no actual statistical significance, so 2.1% in placebo versus 1.6% in the Romo group. A lot of reasons why that may be the case. One of the main things is that it was actually, so I had the opportunity to be actually one of the sites for this trial, and it was a very tough recruit trying to get these patients naive to bisphosphonate to get enrolled. So they had to go to a lot of Latin American sites, making up almost 40% of the sites that they recruited. And that when we actually do a subgroup analysis, and the Latin America sites had a much lower baseline risk of fracture using FRAX, so their event rate was much lower, and then that's partly the reason why it did not show any significance. Another reason is that in all the other fracture prevention trials, typically patients will get randomized to drug versus placebo for more than a 1-year duration. So that one year of treatment versus placebo before crossing over may have been too short to show an effect for non-vert fractures. And then the third thing is, when you're switching to something like denosumab, which is actually very good at preventing non-vertebral fractures in its own right, having that crossover at 12 months really does lead to a lot of washed out of the effect. So overall, this drug has a lot of promise. It's coming soon, so keep your eyes out. For more information, go to Rheumnow.com. I've posted a couple of tweets in the last few days with the attachment of the manuscript as well. So enjoy the conference, everyone.